On fine day, me and my friend were having a cup of coffee and we were discussing about a Goa trip which we went 3 years back. Now suddenly we hear a sound from the window. As soon as we turn towards the window and try to locate where the sound is coming from, my friend shouts in pain and started saying I got an electric shock. Now normally we try to find any loose wires present or any electrical equipment. There were nothing so far. Then I started wondering what might have caused him this. Upon digging deep into it, he said that he is having fatigue and weakness in his limbs from few months, which might have also caused him some balancing issues according to him. And he usually gets irritable for small things and even confused at some times. During the same time, I also noticed that he started wearing spectacles from few months, so there was blurring of vision. Upon hearing all this, I wanted to investigate. So I ordered for CBC, serum electrolytes, glucose profile, and upon hearing irritability, confusion, balancing issues, and blurring of vision, I wanted to rule out some CNS pathologies. So I also ordered for MRI. Seeing the reports, electrolytes were completely normal, the glucose level are completely normal, but surprisingly, the MRI showed demyelinating lesions, which were specifically in spinal cord and some parts of the brain. On hearing demyelination, one thing that came to my mind was multiple sclerosis. So I ordered the antibody profile, that is ANA profile, and I also gave for CSF analysis. CSF analysis was completely normal. There were no oligoclonal bands. And ANA profile, that is, there were no autoantibodies also. What might be this patient suffering from? Remember, we also ordered for CBC. In the complete blood count, when I saw the patient was suffering from anemia, so I also sent for the peripheral smear. In the peripheral smear, we got to know he had the megaloblast. So he was suffering from megaloblastic anemia. When we talk about megaloblastic anemia, either there is folate deficiency or B12 deficiency as the two main causes. When I checked his folate intake, which was completely normal, and there were no other causes which has been causing him folate deficiency. When we think of B12 deficiency, he was completely non-vegetarian. He didn't have any surgeries in the past, and his antibody profile was also completely normal. So pernicious anemia is also ruled out. So, but for the last, I wanted to rule out about malabsorption syndromes. So I ordered for the stool sampling, where surprisingly we found out these eggs. Yes, these are the eggs of Diphyllobothrium latum, that is fish tapeworm, which is acquired by eating raw fish or undercooked fish. Upon asking his fish intake, he said that he last had his fish in the Goa trip. Yeah, exactly the same Goa trip we were discussing about. So on having that fish, he had acquired the Diphyllobothrium latum, that is fish tapeworm, which caused him megaloblastic anemia. Once he developed megaloblastic anemia over the years, it turned into the SACD, that is subacute combined degeneration, which has caused him demyelination. This demyelination of the optic nerve caused him blurring of vision. The same demyelination caused him balancing issues, and this demyelination also caused him that electric sensation, which is called as Lermaites sign. In this, whenever a person bends or turns his neck, he feels a shock sensation which is running in the back towards the legs. This is usually seen in any condition which causes demyelination.